Dr. Vasvada is active in several scientific and professional organizations, including the International Association of Food Protection and the Institute of Food Technologists. He's a co-author of more than 100 publications, including peer-reviewed papers, technical abstracts, and book chapters. He serves on scientific advisory committees of various industry organizations and is a frequent contributor to food industry conferences and educational programs. Joe Stout founded Commercial Food Sanitation, LLC, after a nearly 30-year career at Kraft Foods. While at Kraft, Joe held a variety of positions related to operations, quality, and sanitation, leading to his role as Director of Global Product Protection, Sanitation, and Hygienic Design. While at Kraft, Joe had global responsibility for plant cleaning controls and processes, allergen and pathogen control programs, pest control, and hygienic design for facilities and equipment used in 200-plus Kraft plants. Joe also managed the Global Product Protection Group, assuring global support for internal and external plants. He is the current leader of the Grocery Manufacturers Association's Sanitary Design Working Group and also conducts allergen trainings for the Food Allergy Research Resource Program. In addition to his involvement with these and many other leading industry organizations, Joe is a published authority on the subjects of food safety, sanitation, hygiene, and other related areas. Evolving situations. This presentation is based on current information consistent with guidance from the World Health Organization, CDC, and FDA, and is supplemented with the author's expertise. For the latest public health information, visit CDC's, FDA's, and NIH's websites directly through the links on your screen. Today, we will be discussing viruses of emerging pathogens of concern, the coronavirus and COVID-19, what we know now, the general strategy for controlling foodborne pathogens, and SARS-CoV-2, including GMPs, PRPs, and FSMA preventive controls, and the COVID-19 virus equation. Before I hand it over to our presenters, please be aware that you can submit your questions at any time using the question box on your screen. I'll be fielding them at the end of the presentation. Also, this webinar is being recorded, so all registered attendees will be notified by email when it is available to watch on demand. And now, without further delay, I will turn it over to Fernando and Joe.
Thank you, Samara. Today, we would like to discuss novel coronavirus, or SARS-CoV-2, and the pandemic COVID-19 in the context of what food industry may want to know about. Burden of disease and emerging pathogens is a frequent topic of discussion among scientists, regulators, and food industry professionals at national and international levels. According to the WHO and CDC estimate, 600 million cases and 420,000 deaths are caused due to the foodborne illness outbreaks worldwide. In the U.S., the foodborne illness causes 48 million cases, 128,000 hospitalizations, and 3,000 deaths annually. Many of these foodborne illnesses are caused by emerging or re-emerging pathogens. So, what are emerging infectious disease or emerging pathogens? The National Institute of Allergy and Infectious Disease defines emerging infectious disease or pathogens as those that have newly appeared in a population or have existed but are rapidly increasing in incidence or geographic range. The CDC defines emerging pathogens as infectious agents whose incidence in humans has increased dramatically within the past 2 decades, or ones that has the probability of increasing in the future. Emerging pathogens are bacteria, protozoa, parasites, and viruses, and many of them are zoonotic organisms, meaning they are transmitted from animals to humans. New diseases are identified every 14 to 16 months or so. Many of the emerging pathogens of greatest concern are pathogenic viruses. The SARS-CoV-2 is a pathogenic virus. Viruses also have been recognized as important emerging foodborne pathogens and have linked to outbreaks and recalls. Examples of foodborne pathogen viruses are norovirus, rotavirus, hepatitis A, hepatitis E, etc. Virus transmission can occur via respiratory droplets through cough and sneeze, air, environmental surfaces, and contaminated food and water. Let us talk about SARS-CoV-2 and COVID-19 and briefly review what we know about its origin, characteristics, transmission, and spread, symptoms and susceptible population, and survival on the surfaces and in environment. Coronavirus are a large family of zoonotic viruses that can cause respiratory illness in humans. Severe acute respiratory syndrome SARS and Middle East respiratory syndrome MERS are two strains of coronaviruses that have caused outbreaks of illness in humans in the past. SARS-CoV-2 is a novel coronavirus not seen before. It is a zoonotic virus, though thought to be originated in Wuhan, China in late 2019. The virus is an envelope virus where the capsid is surrounded by a fatty envelope made up of phospholipids and proteins. The protein spikes protruding from the virus gives it a crown-like appearance and hence the name coronavirus. The virus causes respiratory disease called COVID-19. The virus is highly infectious and anyone can get COVID-19. As of May 14th, millions of infections worldwide and thousands of deaths have occurred due to the pandemic of COVID-19. COVID-19 transmission occurs by respiratory droplets through cough, sneeze, and close contact. It can also be transmitted by person-to-person contact by touching contaminated hands and surfaces. The virus affects high-risk groups, elderly, and people with underlying conditions such as heart disease, diabetes, etc. It can also affect younger population, although children are supposed to be less susceptible. The onset of illness is usually 4 to 5 days after exposure. 97.5% of people show symptoms for day 11, and almost all people show symptoms by day 14, with few exceptions. It is important to note that the virus can have asymptomatic spread, meaning it can be transmitted by people who are infected but do not show symptoms. So what are the symptoms of the COVID-19? The main symptoms of the COVID-19 include dry cough, fever, chills, shortness of breath, trouble breathing, headache, back pain, and fatigue. However, additional symptoms, including loss of sense of taste or smell and a red or purple discoloration resembling frostbite around the toes, called COVID toes, and hypoxia have been reported. Also, just recently, pediatric multisystem inflammatory syndrome, similar to Kawasaki-like disease and toxic shock, have been reported in some children. The COVID-19 is transmitted by respiratory droplets. You're going to hear this time and again. And close contact. It is not known to be transmitted by food, and key mitigation includes washing hands, mask, face covering, and social distancing. So there is a lot of interest in how the virus is transmitted through contaminated surfaces. And recent publication in the Journal of Hospital Infection analyzed 22 studies that showed that the human coronaviruses such as SARS and MERS can persist on inanimate surfaces like metal, glass, plastic for up to 9 days. The study also showed that the virus can be efficiently inactivated by surface disinfection procedures with 60 to 71% ethanol, 0.5% hydrogen peroxide, or 0.1% sodium hypochlorite within 1 minute. Another report showed that SARS-CoV-2 virus can survive on surfaces such as doorknobs, wood, plastic, stainless steel, cardboard, etc. for a few hours to 5 days. The virus was also detectable in air for up to 3 hours. However, the capability of virus to cause infection decreases over time. This is important information for food industry as they develop strategy for controlling the threat of SARS-CoV-2 and COVID-19. Finally, the SARS-CoV-2 is a novel virus and there is not a known treatment or vaccine is available. There is much research going on, including some experimental treatments on clinical trials, and a Manhattan Project-style effort dubbed Operation Warp Speed, designed to drastically cut the time needed to develop a coronavirus vaccine, has been launched by the government. As the mitigation measures such as stay-at-home, social distancing continues, many myths, misinformation, and conspiracy theories caused by infodemic related to coronavirus and COVID-19 are circulating on social media. This is probably for discussion for another day. So, how do you control COVID-19? The main approach would include reducing the risk by reducing person-to-person transmission, hand washing, hand sanitizers, personal protective equipment, and social distancing. Controlling COVID-19 in food processing facilities will follow the same general strategy, focusing on GMP, PRPs, and implementation of FSMA preventive control. In other words, back to basic. Food industries experienced large outbreaks of illnesses in the past, many dealing with emerging pathogens. The changing paradigm of food safety is going from reaction to prevention. For the past 40 years, food industry have focused on proactive, preventive, and systematic approach based on GMPs and HACCP. Since 2016, the food industry is implementing FSMA preventive control regulation. This regulation shifts the food safety focus away from reaction and response towards prevention, so that prudent preventive measures can be built into all parts of the food safety management system. General strategy of controlling foodborne pathogen uses a combination approach, including identifying hazards and risks and sources of hazards, improved cleaning and sanitation protocols, emphasis on environmental monitoring, especially for ready-to-eat foods, hygienic design of equipment, and reformulating product to inhibit growth. Training of personnel is very important in this aspect. In light of problems of E. coli 57187 in meat industry, salmonella in dry products, and Listeria monocytogenes in ready-to-eat foods, the food industry has successfully used pathogen control equation developed considering main aspects of GMPs, sanitation control, hygienic design of equipment, traffic pattern of people and material, and airflow, etc. Our co-presenter, Joe Stout, has a critical role in developing these equations. Our experience shows that mismanagement of any of the components may increase the risk of contamination. Now, let us discuss GMPs and PRPs. GMPs and CGMPs are the basic operational and environmental conditions required to produce safe food. They ensure that ingredients, products, and packaging materials are handled safely and the food product is processed in suitable environment. Most GMPs are managed as prerequisite programs outside the food safety plan. Some may be elevated to the preventive controls based on your food safety plan. Training is essential, and effective implementation of GMPs and PRPs does require training. We should note that violation of GMPs may result in the food deemed adulterated. As a part of the implementing the FSMA preventive control rules, the FDA revised and modified the CGMPs, which are published in Subpart B of the Title 21 of the Code of Federal Regulation, Part 117. Subpart B of the regulation lists components that establish the conditions and practices that food industry must follow for processing safe food under sanitary conditions. They are an important part of regulatory control over food safety, and GMPs also serve as one basis for the FDA inspections. The key sections of the CGMPs most applicable to COVID-19 control are personnel, and sanitary operations. The section on personnel deals with disease control and cleanliness. It requires that ill person must report their health conditions to their supervisor and they should not be allowed to conduct any operations which may result in contamination until the condition is corrected. Of course, cleanliness requires that all persons working in direct contact with food, food contact surface, and food packaging materials must conform to hygienic practices. The sanitary operations section deals with sanitation of food contact and non-food contact surfaces. All food contact surfaces must be cleaned as frequently as necessary to protect against cross-contact and contamination of food. All non-food contact surfaces of equipment used in operation of a food plant must be cleaned in a manner and as frequently as necessary to protect against cross-contact and contamination of food, food contact surfaces, and food packaging material. As mentioned before, GMPs serve as one basis for FDA inspection, and GMP violations has resulted FDA issuing 483s, that is observation issues and warning letters. So let's go back to the basics, and the whole idea here is reducing the risk. SARS-CoV-2 and COVID-19 is not transmitted by food or food packaging, but contamination is spread through respiratory droplets and person-to-person contact and contaminated surfaces. So strategy for controlling coronavirus risk include reducing the risk by implementing GMPs, PRPs, and implementing policies to minimize risk of contamination by humans. The back to basics of GMPs and PRPs, of course, include implementation of GMPs, implementation of food safety plan and preventive controls, hand washing, and I can't emphasize hand washing enough. Use of PPEs as appropriate, apron, face covering and mask, gloves, etc., and frequent and effective cleaning and sanitation. Also, sanitizing frequently touched surfaces such as door handles, side of equipment, etc. is important. And training must be emphasized in all this. An important part of control strategy of protection is protection of workers and minimizing spread of the virus. This may be achieved by wellness check to prevent sick person from plant operations, minimizing crowding and close contact by segregating groups, physical separation, and practicing social distancing as possible. The company must develop and implement policy for employees and visitors and communicate them to all concerned. Minimizing potential airborne contamination by controlling people and material traffic is also helpful. Finally, a comment about meat plant situation. In last few weeks, you might be aware, workers in several meat plants in Midwest USA were infected with COVID-19. There is a growing concern about coronavirus outbreak among employees, and many meat plants were closed due to COVID-19. But meat and poultry processing plants are considered essential business and critical infrastructure under the Defense Production Act and are allowed to remain open during the COVID-19 pandemic. The CDC and OSHA have issued guidance to assist employers in assisting workplace risks, update their employees on information and training, ideas for using PPEs for workers, and considering alternative workplace hours and settings. While not a standard or regulation, the guidance is a set of recommendations and descriptions of mandatory safety and healthy standards. Now, let me turn this over to Joe to discuss the COVID-19 equation. Joe, over to you.
Thank you, Dr. Vasavada, and hello to everyone that's joined us to learn more about controls on COVID-19. And it was mentioned before a couple of times, the primary mode of transmission is when an infected person would sneeze, cough, or get in your face without proper protection, where there's a chance that those respiratory droplets that Dr. Vasavada talked about could be transferred to your eyes, nose, and your mouth. Also, infection can occur if you touch a surface that may have been a recipient of respiratory droplets. And fortunately, there's no evidence that transmission occurs via ingestion of food or liquids. Okay, this is a short video that depicts
Stay healthy.
with and without the use of a mask.
Stay healthy.
Great. Less loud.
Stay healthy.
Good.
And with a mask,
Yeah.
and this is the
Stay
person
healthy.
speaking.
Louder.
Stay healthy.
Louder.
Stay healthy.
Nothing.
Okay, so we can see clearly that the droplets can be spread even by talking to someone who is adjacent to you. This becomes really important in a food plant operation where you have elevated levels of noise, high decibel readings. If you're on an airplane, it's very noisy. Normally on an airplane, the decibel reading is about somewhere between 90 and 100. And so for someone to hear you or to hear the flight attendant, they need to raise their voice. You need to raise your voice. And with every elevation of your voice, there's an increase in the probability and the number of droplets that you'll emit from talking. So in a food plant, we're better off wearing a mask. At home, if you are in a safe environment, it's okay not to wear a mask. But if you're in an environment that you don't know is safe, you should wear a mask. And this is something that is really, I think, a challenge for all of us in a food plant. Our employees come in and they're in our plants 8 to 10 hours a day, maybe 12 hours a day. But then they leave the plant. Sometimes they carpool home. They go to homes where they have multiple people working, and there's a lot of potential interaction with people that have been exposed to other people and situations. So that's when it becomes very hard for a food plant. Not only do we have to worry about the people when they're in the plant, we have to worry about the people when they're not in the plant, because what happens when they're not in the plant could impact the manufacturing facility. So it's almost like changing the culture and encouraging people to have good behaviors, not only when they're with you and at work, but also when they're home before they come to work. So at Commercial Food Sanitation, we put together what we call the COVID-19 virus equation. And this is to provide a holistic view of those things that you should do to minimize the risk to your employees. This is not about making safe food. This is really about protecting your employees so they don't become ill. And also that means communicating to them about at-home practices and also commuting practices, because ultimately, as we've seen, if a lot of people in the plant get sick, we're not going to be able to make food. They're an important component and ingredient to the food that we make. So the real key one is item number 1, which is to have a plan, communicate it, educate it, train, and execute the plan flawlessly. And all the items to the right are about what you need to do. So Dr. Basilata talked about GMP ware. There's a lot of FSMA-related GMP practices that fit very well into what we're doing here. Except the facial coverings, not a mandate, and the 6-foot distance, not a mandate. But very important basics that the food industry knows and learns. Number 3, employee space routine and rules established and followed. In a large plant where you might have 600 people or 300 people or 1,000 people, just the fact that they show up to work and they have shifts that start at 8 o'clock in the morning or 7 o'clock in the morning, and everybody wants to come into work at the same time and leave at the same time, it's a real challenge. So the question is, how can you meter people in better by changing some of those shifts, rotating breaks, rotating lunch hours, to allow for people to have space as they ingress and egress from a facility. Number 4 is hygienic design solutions to zoning, ventilation, and separation. Through better hygienic designs relative to COVID-19, we can enable people to more easily follow the rules, and we want it to be easy for people to do the right things and take the right approaches rather than hard to do the right things. And oftentimes, hygienic design methods, less doors to push open, for example, or automatic doors, better ventilation is really helpful in controlling spread of this virus. Number 5 is high touch points identified and maintained clean. And that's a real critical one. Again, that's the second reason that Dr. Vasavada mentioned for the spread of this disease. It's respiratory droplets and where they might land that you might touch later on. Very important. And number 6, if we do have droplets in a place we don't want them, what are the SSOPs for cleaning, for viral removal and destruction? Okay, so all of these things are really important to ensure success, that you can continue to produce food and ultimately have a standard of care and a safe workplace for your employees so they're not fearful about coming to work. My following slides will go into some of the details behind each one of these, and we call them principle number 1 through number 6. Number 1, assign a leadership position to advise on optimal approaches, and that person should connect with public health. I mean, public health folks are partners in this with us, and we need to have a relationship and an understanding of their concerns, and it's really good to have them get an understanding of what we're trying to do. Also, a cross-functional teams are really important, just like we do with other challenges we have in the food industry and a plant. We need a cross-functional view, not only to get work done, but to think of the impact from one function to another function, maybe from maintenance to sanitation to HR to operations, right? We all need to work together. Risk assessments are important, looking at traffic flow, watching employees come in when they come into work, see how they punch the time clock, if there is punch or is it a handless punch, are your sinks hands-free? There's a lot of things that you can look at when you critically look at what employees do and what the practices are. And once you have that risk assessment, what are the protocols and expectations that will minimize safety or concerns about safety with the employees? Essential employees should be in the facility. Minimize visitors whenever possible, and encourage the team to look for engineered solutions. And I say this because engineers don't think of improvements all the time. The people that are out on the floor doing the work can tell you how you can make their job easier, better than an engineer or better than a manager. Talk to the people that do the work and watch them, and we'll get an idea about some of their concerns and how we might make it easier and accommodate some of their concerns. And create a checklist and an action plan in the event an employee is positive, and obviously this happens, and understand the risk of encounters with coworkers. Who did that person work with? How is that going to be managed? You pass someone in the hallway that turned out to be positive for COVID. What do you do about that? Is that an issue? How do you, and that's when it goes back to the functional team and really knowing the environment and knowing the controls you have in place. So a plan for employees, this is based on the risk assessment, key program elements, social distancing, enhanced GMPs, high touch point cleaning, and sanitizing. So you can imagine when an employee comes into the plant at first thing in the morning, into the locker room, time clock, and then an important critical area, GMP area, so they can get properly attired. right? So they have the right gloves, they have the right space, they have the right tools, so they have a good workstation. And when they leave to go to break, another GMP area. What about when they go to the restroom? Another break area for lunch, GMP area. So all these things need to be considered as you follow that employee through the plant to make sure that they're safe at all times. And again, safe employees are going to be with you. And I can't overemphasize the need to try to change the employee's culture about how you fight this virus so they have an understanding and they'll be with you. Principle number 1, training. Cross-functionally training employees in the event you do have absentees. So you want to cross-train maintenance people, some line operators, some sanitation people to ensure that you have people that can do the work if they are not already cross-trained. Training topics, for example, be safe at home, at work, and in between. What are potential routes for infection at home? What's safe, what's not safe? What are some wellness checks? How do you self-report? It's not, if you're sick, it's not, and it shouldn't be a concern to call into work sick and say, you know, I'm not feeling well. I think I might have been exposed. I have some symptoms. Let people know about it. Don't put yourself at risk and your company and coworkers at risk. What GMPs are important related to virus transmission at work and at home? What about riding in your car with 5 people? Well, that's a challenge. What about getting on the subway? That's a challenge. What do we need to do for social distancing in plant and also in your personal life? How do you manage through that? And good techniques on hand washing and sanitizing and no touching your face, mouth, or your eyes, right? Disinfectants, people should understand their use. A lot of times when you go to the supermarket, they give you a wipe to wipe the bar on the push cart, right, on the basket. Well, when I observe people doing that, they just give it one wipe and then they're done. But is that enough? And if you would read the label, it probably needs contact time up to 4 minutes in order for that surface to be sanitized. So knowing how disinfectants work and the amount of time that is needed to make a disinfectant really disinfect is important that people need to understand. And then what about the rules for personal protective equipment, for gloves, face masks, aprons, face coverings, and face shields, excuse me. Things like, okay, well, you know, I have to go to the restroom, and should I take my face mask off? And where do I put it, especially if there's a shortage of face masks? What about gloves? Do I have to reuse my gloves, or do I wash them, sanitize them? Where's the next sink that I can use to wash my hands? And that we talk about also in the hygienic design. Documentation, I'm not going to spend a lot of time on this slide, but you know, you should document what you do, just so people get used to the routine of understanding what is right and what is wrong. And also the use of mock protocols to be taken if you have a positive employee. What would you do? What does a symptom look like? How do people act if they are positive? What should you expect? And then some audits would be helpful to just understand, once you're underway, if your employees are social distancing and if there is general awareness of virus and viral control. And this can be gotten just by talking to employees on the line. Okay, personal protective equipment. Obviously, we have a strong preference for single-use disposable tools. Wash and disinfect hands after removing gloves. It's been a real challenge for food plants and hospitals to get PPE. And when you have a shortage of PPE, it's really difficult to say, okay, well, throw away that mask and then not have anything, right? So how do you manage through that? I think we're getting much better now in terms of a supply chain. Utilize non-medical face shields and or nose mouth. You don't need a N95 mask for working in a food plant. Cloth masks are acceptable. And by the way, the video that I showed earlier, that was actually a washcloth that was damp that prevented the droplets from being emitted from that person when they talked. So they do provide protection from getting droplets out and contaminating somebody else. Follow your chemical safety data sheets and PPE requirements if you're using chemicals. And a lot of times we ask employees to sanitize the workstations at some frequency during the course of a shift. So during that time that they use those chemicals, they ought to be following and understand the PPE requirements and the safety data sheets. Any PPE breaches for correction and corrective action. So if you see people touching their face masks, that's bad. So they need to have some coaching because that's one of the problems. Early on in this crisis, there wasn't a push to use face masks because there are risks with using face masks, and one of those risks is people typically adjust that face mask and touch their face more frequently because at times they're uncomfortable. Or you go to talk to somebody and you move it. Well, that's a potential contamination point and a breach of a protocol. So they're the things that we need to continually remind people of and provide coaching to try to minimize that risk. And obviously keep a close eye on your PPE inventory because it is in such short supply. Rules for prevention, social distancing, workstations that minimize close employee contact, add physical barriers. This is part of the hygienic design if you can, or the design is where you can't do social distancing at 6 foot if you're on a production line. What can you do with plexiglass or separation or alternating positions on either side of the line? I mentioned earlier about staggering shifts, changing traffic patterns and physical distance and prevent traffic jams, and enhanced GMP. Employees with fewer or other symptoms or illness must not come to work. If somebody wakes up in the morning and they're not feeling well, let them have the option of calling in and say, I don't feel well, and I may not be able to work. Have employees disinfect their workstations routinely wash and disinfect your hands after coughing, sneezing, and this should be commonplace in a food plant. I think what we see now, though, is in many food plants, there's not adequate sinks and sanitized stations to do this easily and routinely. And in many cases, plants have added sanitizing stations since the COVID-19 crisis came up, pandemic, but still don't have as many hand wash sinks as we could use out on the floor. Rules for an employee if positive. They should be self-quarantined for 14 days, and you have to go with the current, at the time, FDA and or public health guidelines. And this could change by area, but there's many people that know more about what's going on in their communities than we can, and that's why it's important to work locally with public health to understand what their rules and guidelines are. Segregated employees' work area and execute cleaning if the plant had not been cleaned since the employee was present. Obviously, you don't find out when an employee is at work at the end of the shift that they were COVID positive, not normally, because they could have been positive for 2 days or 3 days. So usually the person calls in sick. You've cleaned the plant since they were there. most cases. And so what is the activity there? And that's where you need that team to come together. The good news is, based on World Health Organization and CDC, we do have good cleaning practices in plants if we routinely clean. And a lot of times those cleaning practices, although it's not a disinfect, will kill the virus. Plant designated contacts should notify public health, right? Plant teams should confirm that cleaning disinfection methods were followed and documented following that and the